Welcome back to On the Beat, everyone. We're over here talking with Dr. Cameron from the Huxford Clinic, and last time he was in, we were talking about sleep apnea and the issues that go along with it and those health concerns. Before we get into the treatment process, just remind everyone at home what sleep apnea is.
Sleep apnea is a condition in which you quit breathing at night, and the typical symptoms are loud snoring, witnessed apneas, and excessive sleepiness.
Okay, the people that would be, getting sleep apnea, are they obese? Is it hereditary? It's like, just break that down for me.
It's very common. I don't believe it's genetic, but it is very common, and we see children to elderly people.
Children?
Yes.
You were telling me off camera that you just recently had a little kid come in.
We had a 2-year-old. His mother thought he was breathing funny while he was sleeping at night, and he was snoring. We sent him for a sleep study. He quit breathing 32 times an hour, and for a child, more than once an hour is abnormal. Okay,
last time you were here, we were talking about some of the solutions to fix this. So you've brought in 3 apparatuses that don't look very inviting for overnight guests.
So this right here is a CPAP. This is the gold standard treatment. It's essentially an air compressor. It generates air under pressure that goes through the hose, and then it attaches to a mask. And the air goes through the mask, and it acts as a splint to move your tongue out of the way, extra tissue in your throat, tonsils, whatever, to create an open passage so that you breathe normally.
Okay, I get it. So we just want everyone to be clear. You don't go to the office and then pick this up. If you think you have it, it's after the initial test.
You have to have a sleep study to get this, yes.
Okay, now, I see there's another one at the very end, and it looks bigger than the one beside it.
Yes, these are just 2 examples of many. There's all different shapes and sizes. They're custom for men and women.
Okay.
And fit over the mouth and the nose or in the nose, so to help people be as comfortable as possible.
All right. I have to ask you, there are people out there, including me, that are claustrophobic. It looks like it would be a problem.
Well, these are full face masks here, so there are others that just fit over your nose that have a very low profile. We have a lot of people who come in concerned with this, but most of the time we can work through that.
What's CPAP?
Stands for continuous positive airway pressure.
Okay, what is that?
It's just as I mentioned earlier, the delivering of air under pressure through the mask to move any tissue out of the way.
So when we see that, everyone, written up, we now know exactly what that means.
Correct.
I do want to ask you, it's a touchy subject, I'm sure, for many people. Does insurance pay for this, or it's out of pocket?
With the visit and the symptoms described, plus the sleep study results, insurance companies will pay for this therapy.
Really?
Yes.
Because it's life-changing, it can save your life.
People's life changes dramatically once you can restore normal sleep.
Really?
Yes.
Well, yes, because we do know you need a good night's sleep to lead a healthy, fulfilled life, but you just don't realize, like you said, that baby that stopped breathing 35 times in an hour.
Now, treatment for children can be different. Tonsillectomy is often curative, so this child had his tonsils removed, and within less than a week, his sleep was back to normal.
Like this. Amazing. Great information, buddy. Thank you for coming in, and we appreciate it. If you want to find out more about Dr. Cameron and the Huxford Clinic, listen guys, if you're not getting a good night's sleep, you might not know that you have sleep apnea. Go in and see doctor and, see if it might be for you. Back after this short break, you're watching On the Beat.